one of our local endocrinologists here at Evergreen Family Medicine in Roseburg. And if you're watching us live, I welcome you. And if you're catching up with us later, I welcome you as well. And today we're going to be talking about a real common problem throughout the world, and including here in Roseburg, Oregon. We're going to talk about osteoporosis. So, and you may be wondering, good thing to talk about first is what is osteoporosis and why is an endocrinologist talking about a bone problem? So endocrinologists normally, if you're familiar with endocrinologists, we talk about hormones. One of the common hormones being insulin. And so we're usually diabetes specialist or thyroid hormone specialist or a female and male hormone specialist. So why is an endocrinologist talking about a metabolic bone problem? That's what osteoporosis is. And in medical school, I didn't know much about the bone. And so if you're with me, I might ask you, what is bone? And it is more than just the shortest distance between 2 points. I guarantee you that. But the reason why an endocrinologist talks about osteoporosis is because, first of all, vitamin D is actually a hormone. I'm sure a lot of you have heard of vitamin D that we get from the sun, and that's real important for helping us absorb calcium. So vitamin D is a hormone. So endocrinologists are vitamin D specialists. And then another hormone involved in the bones is called not thyroid hormone, but parathyroid hormone. And parathyroid hormone recommends your body's calcium levels. It's real important to maintain very stable calcium levels in your body. And so the parathyroid hormone levels will help your body get calcium from your bones to maintain normal blood levels. So because those two hormones, vitamin D and parathyroid hormone, those are the main reasons why endocrinologists over the years have become the osteoporosis specialist. So, we'll start off, so what is osteoporosis? So osteoporosis is basically, fragile, weak bones. And this is what a bone looks like, close up. This is a healthy looking bone, on a microscopic picture of it. And as you might guess, the porosis part of osteoporosis means porous bone, kind of looks like a sponge. This is normal looking bone, but someone with osteoporosis, these holes that you're seeing would be much larger, and there'd be a lot of empty spaces in your bone. And so that's what osteoporosis is. It's, thin, weak bones that break easily. And it is the most common bone disease in the world. It affects about 1 out of every 2 women. 50% of women have develop osteoporosis sometime in their lifetime. And then even one out of every 4 or 5 men also develop osteoporosis. So much less common in men, but is still significant. So osteoporosis, we like to call it a silent disease, because there's no symptoms of osteoporosis until you break a bone, and then you have a lot of symptoms. Now, a lot of people get confused with the word osteoarthritis and osteoporosis. So if you're having a lot of achiness in your joints, your hips, or your back, that's not osteoporosis. That's osteoarthritis. So very different. If you have an arthritis problem, you'd go see a rheumatologist if you needed to see a specialist instead of an endocrinologist. Again, here's our picture of a healthy bone. So when you have a not so healthy bone, so what are the consequences of having of osteoporosis? So like we said, it's silent. You don't realize you have it until you break the bone. And of course, can be very painful. If it happens with a hip, if it happens to your back, that can also be very painful and affect your quality of life severely. But when you break a bone, you end up in the hospital, laying in a hospital bed, having to have surgery to fix it, and then often spending several days to a few weeks in a nursing home facility. And 50% of people who break a hip will not be able to return to their normal, daily activities. So about 2 million people a year break a bone, about 300 to 400,000 of them will be the hip. The most of the rest of them will be either in the spine. One of the reasons that some people get kind of hunched over as they get older is the fractures in your spine. Those little building blocks of your spine get kind of crunched down from osteoporosis. So they go kind of hunchback. We call that in the Dowager hump. We call that in medical terms. But so you get the hip fractures, you get the spinal fractures, and also you get wrist fractures and ankle fractures from osteoporosis. So about 2 million a year, and right now it's costing us about $20 billion a year is what we spend on medical care, taking care of the consequences of broken bones. Even worse, oftentimes, as far as hip fractures, a hip fracture will be the last kind of medical problem that an individual will have in their life. That is to say, 20% of people at some time in a year after they break a hip, they will die from complications related to a hip fracture. And so not only is it painful, with a lot of tough recovery from a hip fracture, it's also going to be, you can die from it. There's it's a pretty high mortality rate from a medical problem. And then also another fact is that within 6 months after a fracture, only 15% of people, after they're recovering, can still walk across the room, unaided after a fracture. So all these things maybe sound kind of scary, but I'm just trying to emphasize how important this problem is, and you should, what we should, and emphasizing that maybe there's some things we should do to try to prevent it, prevent fractures. Kind of to put it in perspective, how common breaking a bone is. If you took the risk, combined risk of all the women they got breast cancer, uterine cancer, and ovarian cancer, that would be equal about to the risk of having a breaking a bone, all those put together. And maybe from a men's perspective, we all know that prostate cancer can be pretty common, but breaking a bone, risk of a man breaking a bone from osteoporosis is more common than prostate cancer. So just to kind of put things in perspective there. So I think we know what osteoporosis is now. So what causes osteoporosis? So some of the causes of osteoporosis is not a lot, just part of the, I guess I would say, natural processes of aging. But the biggest risk of getting osteoporosis is you get it as you get older. Our bones, our bones get stronger as we grow, and we reach our peak bone mass for men and women is, 80 to 90% of your peak bone mass you already have by around age 80 or 90, or 18 or 20, age 18 or 20. And it keeps going up a little bit till about age 25 or 30. Your bones keep getting stronger. But then, like so many things in life, after age 30, it's kind of downhill after you get to age 30. Your bones stop getting stronger, and they slowly decrease. And then once estrogen is real important for the health of a woman's bones and a man's bones. But after, when you go through menopause, when a woman goes through menopause, the estrogen levels drop, go down low, and then the bone density along with that can also drop significantly right after menopause. So, in your early 50s, your bone density starts falling. Of course, some women, when they go through menopause, will choose to go on, menopausal hormone therapy with estrogen, and that can help a lot. We're not going to talk about this a lot today, but taking estrogen, bioidentical, the same estrogen that you were making when you're younger in your life, that can help prevent osteoporosis. But the main two things, though, for the cause of osteoporosis is aging and low estrogen. So what else can contribute to osteoporosis? Smoking tobacco. There's so many reasons not to smoke tobacco. We all know that, and this is just another reason. Smoking tobacco increases your risk of osteoporosis and having broken bones. Drinking alcohol excessively is a risk factor. Being physically inactive kind of fits the use it or lose it phrase, and then poor nutrition in general increases your risk for osteoporosis. Just to kind of emphasize, what I think it's kind of interesting. One of the risk factors of osteoporosis, when people go up into space, like the astronauts, they've studied them a lot actually over the years. What happens to a person's bones up in space? There's no gravity, so their bone density decreases a lot when they're in a short time when they're up in space, and so they try a lot of things to prevent that while they're in space. Trying to, and it's not easy to do when there's no gravity. We'll come back to this as far as like therapy measures you can take to prevent osteoporosis. But so there's our risk factors and our causes for osteoporosis. So, like I said, it's a silent disease. You don't know if you have it often until you break a bone. And not obviously, if you're in a major car accident and you have some major trauma and you break a bone, that doesn't mean you have osteoporosis. But osteoporotic fractures, we call them osteoporotic if you have just kind of minimal trauma. Maybe you cough real hard. Someone coughs real hard and they get pain in their back because they break a bone. That can be that's a osteoporotic fracture, and we call those fragility fractures. If it's just kind of a mild fall, you fall down, from ground height and land on your hip and you break it, we call those fragility fractures, and that's probably due from osteoporosis. So if you don't want to wait till you have a fracture or break a bone before you realize you have osteoporosis. So what's a better way to find out if you have osteoporosis so you can prevent breaking a bone? What's a better way? Well, you can measure your bone density. This is with a DEXA scan or a bone densitometry measurement. This technology has been around for probably 30 years, and it's a really common screening measure that we use in adults to see if you have osteoporosis. It's a test that you're exposed to less radiation than getting a simple chest x-ray, so there's hardly any radiation at all. Again, less than probably 30, you have to do 30 bone density tests before you have the same radiation exposure as one chest x-ray. So if we want one strong recommendation for women, if they want to find out if they have osteoporosis, is to get every woman should have a bone density test at age 65 or older. And because it's just so common, it's worth, everyone is at high risk for getting it, it's worth checking that in every woman age 65 and older. So it's a simple test. You go in the room, you lay down at a table, it takes about 15 minutes, and then you leave, and you can find out, a radiologist or myself will interpret the study, and we'll find out if you have osteoporosis or not. And then for younger women, some younger women and men should also get bone density tests. So if you're a younger woman, in the early 50s, less than age 65, there's some other conditions where you should also get a bone density test. So if you're a younger woman who has low body weight, that is like really thin, or you smoke cigarettes, smoke tobacco, or you've had a fracture that's kind of suspicious for osteoporotic fracture, you're someone who should also be getting a bone density test early, maybe in your 50s, as opposed to waiting to age 65. So we know that this is a good way to find out if you have osteoporosis or not. We know that osteoporosis is really common, and we know that morbidity from osteoporosis is really high. But only 10 to 15% of women in the U.S. get this bone density measurement, get a DEXA scan. And it only costs about $50, and insurance covers most of that. So it's not expensive. It's easy to do, and yet, that's why I'm here today, is to kind of, tell people about this. Hey, this is a way you can make your life more pleasant in your later years, in your golden years, and you should take advantage of this simple test that you can do. All of your primary care providers know about this test, and you should ask them about it. So get a bone density test. So let's say whether you find out or for sure we have osteoporosis or not, or you just want to start preventing it now, even before you know you have osteoporosis or don't have osteoporosis, what are some healthy lifestyle things you can do, or how can you prevent getting bone fracture? How can you prevent breaking a bone? So first, so a healthy diet. So calcium is like the building blocks of our bones, like the bricks. If you're building a wall, you got to have the bricks. Calcium's so you need these calcium and other minerals, but particularly calcium. So eating foods that are high in calcium, like dairy products or particularly green vegetables, like dark leafy greens, like kale and lettuce, broccoli. Those are green vegetables, but also there's some other things like almonds, some nuts, and dairy products, as you know, cheese, cottage cheese, milk. For some people, dairy products can be a lot of calories. That may not be the best way to go. But if you don't think that you're getting enough calcium in your diet, some people have medical problems. They're not supposed to eat a lot of certain foods. Then the next best thing to do is to actually take a calcium supplement or a pill that has calcium in it. And generally, you should be getting about 1,000 to 1,200 milligrams a day of calcium. But you can't just take it all at once. You have to spread it out during the day, like maybe part of it with breakfast and part of it with dinner. But at mealtime, generally calcium absorbs better at mealtime. So lots of calcium. And then the second thing that's important is the hormone we talked about earlier, vitamin D. So, vitamin D, we get most of that, from the sun. Just like today. Today's actually a pretty nice sunny day here in February in Roseburg. And that's the best way. It's hard to get vitamin D naturally from food unless you drink a lot of cod liver oil. Otherwise, it doesn't come naturally. You have to get it from the sun. So for a lot of people, it really is necessary to take a supplement. And I try to keep it simple. And I think most people need to get around, most people who are concerned about their bones need to take 1,000 international units a day of vitamin D3. There are other things that can be done, but that's the simplest and most common thing that I recommend. So vitamin D, calcium, and what's some things you shouldn't do? Obviously avoid smoking, and you want to limit your alcohol and caffeine. So no more than 1 to 2 drinks a day of alcohol or calcium. That's another good thing to do to help prevent osteoporosis. And then lastly, is, I referred earlier to like the astronauts that go up into space and get get low bone density, osteoporosis, is exercise, but not just any type of exercise. It needs to be weight-bearing exercise. That's where you're like putting some pressure on your bones to make your bones stronger. Your bones are we think that sometimes we might think that bones are kind of like just a stick, a dead piece of wood. But actually the bones are a very live organ in our body. And they're constantly building up and they break down and build up. There's this process called turnover of our bones. And when you stress your bones, they get stronger. Just like when you work out a muscle, it gets stronger. So we want you should do weight-bearing exercise, which can include things like just walking, or if you're more into, want something a little more aggressive, even jogging or jumping. And then in addition to weight-bearing exercises, resistance exercises. So which includes lifting weights or holding weights while you do squats or some other types of exercises. And sometimes it's good to get some specific instruction on this, but a lot of times you're able to look it up on the internet or talk to your primary care provider to learn about some exercises. But generally recommend doing about 30 minutes, 3 days a week to make your bones stronger. So the biggest thing you can do, I say this to patients all the time, if you don't want to break a bone, don't fall on your hip if you don't want to break a hip. And that's obvious, of course. So around your house, you want to take measures that to decrease your risk of falling. So not having things strewn all over the floor, electrical cords everywhere, so that you're going to trip on. Wearing good sturdy shoes it's safer to be walking around your house in some good shoes rather than your socks, or you might slip on the floor. Make sure everything's lighted. If you're at night, if you the path from the bed to the bathroom should be clear, and it shouldn't be dark, so you can easily find your way to the bathroom. And then, like I said, avoid slippery floors, rugs, those types of things. Some real kind of common sense things. A fair amount of times I'll see a patient who was up on a ladder by himself and fallen off. And when you climb a ladder, you should have someone there holding the ladder, or keep an eye on it while you're going up the ladder. That's a real common story. Nobody likes to find somebody to help them hold the ladder, but until they fall and break a hip. So those are the lifestyle things you can do to help your bone health. What about if there's something more you can do? How do you know if you need medication? So there's a lot of medications out there to help with preventing and treating osteoporosis, and it depends. Whether or not you need medication depends on your risk. If you're a really low risk of having a fracture based on your bone density and other lack of other risk factors, then maybe you don't need to do anything else other than eat healthy and exercise. But if you have a high risk of having a fracture, then you may need medication. So what are some things that go into increasing your risk of having a fracture? So as we kind of talked earlier, as you get older, just getting older increases your risk of having a fracture. And then you get your bone density measured, and you find out if it's low or high. And if you have really low bone density, that increases your risk of having a fracture. If you've had a fracture before, you've already broken a fracture in your back or your hip, you're really high risk of having another fracture. And then other medical problems can be associated with having a fracture. Another common situation is if you had to take what we call corticosteroids, most common one being prednisone. If you're someone that has to, for other medical condition, have to take a lot of prednisone, that increases your risk of having a fracture significantly. So you got to talk to your provider about this. You got to ask them, is my risk, they can tell you, is your risk low, is your risk kind of moderate, or is it high or very high? And certainly if it's high or very high, you're someone that probably needs to be on a medication. So I don't intend to go into all the osteoporosis medications today. We could spend an hour in itself talking about that. But these medications for osteoporosis have been around for at least 3 decades, and you can hear a lot of stuff on TV or the internet about the side effects of these medications. But the truth is, millions of people take these medications every day, and compared to so many other medications that we take in our lives, these are quite safe. So the medications out there are bisphosphonates. The most common one that we all know for years was Fosamax, has a generic name of alendronate. So this is a class of medications that is most commonly used. And, for 99% of people, this is a very, very safe medication without side effects. I like to mention, even my mother, who hates to take medications, even she's on one of these medications. And so if someone can get her to take it, then I think just about, most women should feel comfortable taking these medications. There are other ones that are, if you have more severe, there are injections that can be every 6 months, every 12 months. A lot of different options. But I'd just like to emphasize that, because the effects of breaking a bone can be so devastating for some people, I just tell them, don't let the fear of these really rare side effects get in the way of taking a very safe and effective medication. It's going to keep you out of the hospital, keep you out of the nursing home, and help you keep leading an active lifestyle. When you're on a medication, after you get your initial bone density test, but then you get a follow-up one about every 2 years. It tells you if your medication is working or not. So that's a common thing to do. And the other thing I wanted to emphasize is that calcium and vitamin D are supplements that are necessary to maintain healthy bones, But calcium and vitamin D alone do not prevent fractures. I mean, like particularly if you've already had a fracture and you say, oh, I just want to treat with calcium and vitamin D, there's just simply no evidence that that alone is sufficient to help prevent fractures. Of course, it's extremely safe, but it's also extremely ineffective taking just calcium and vitamin D alone. If you have a high risk for fracture, you really want to go on these medication for that. So what if you already broken a bone? I mean, this, I see this patients with this in the hospital all the time. Never had a bone density test, didn't realize they have osteoporosis, but they end up in the hospital. So I see them when they're, laying in bed with a broken hip. But then what should you do? Well, you want to do whatever you can to prevent another broken hip. Because that's, obviously if you already have one fracture, you're really high risk for getting another fracture. So to help to start the process to finding out, verifying that you have osteoporosis, you want to get a baseline DEXA scan. So you're going to get a DEXA scan after you get out of the hospital. And then, if someone doesn't offer it to you, then you ask about it. And then you also want to get on osteoporosis medication. All right. So you want to get a DEXA scan, get on a medication so you don't have another fracture, broken bone again in your life. And again, don't let your fear of these extremely rare side effects get in the way of taking a good medication. And remember that just taking calcium and vitamin D alone is not going to be enough to help prevent another fracture. So that really comes to the end of my talk today. I'm trying to think if there's anything else that I wanted to cover today. I'm hoping that if there are questions, if you're here live with me, I could be happy to answer them. But we're kind of getting this process going again at Evergreen Family Medicine. During COVID, we were doing so much of this stuff just through virtually. But we're trying to get it going live again, so you can show up right up here in the room and we can talk, have a conversation with all our great providers here at Evergreen Family Medicine. And I'm just going to ask my IT people here real quick. Are there any questions out there? And so I don't think we have any questions today. Again, as an endocrinologist, everyone with osteoporosis doesn't need to see an endocrinologist, but sometimes there can be complicated, little tough decisions about whether or not you need to go on a medication. So they'll send referrals to me, or someone for a lot of different reasons. It's usually for trying to make that big decision about going on a medication or not. But for most people who have osteoporosis, the decision can be pretty clear that they need to go on a medication, and most providers are pretty comfortable prescribing that medication to you. But if you feel like you need to see a specialist in osteoporosis, I'm happy to see you. Myself and my colleague, Dr. Racine, we would love to see you and help you out, and because we don't want to see you when you're in the hospital laying in bed. We want to see you walking into our clinic, looking nice and healthy. We want your bones to keep looking like this on the inside. And with that, I think I'll wrap it up. And thank you for your attention. Thank you for watching us. And if you need some help, I hope we see you soon.